Ontario's top doctor is taking issue with Niagara Region's decision to introduce stronger COVID-19 measures in schools around dismissing classes, masks and air filtration. It's a departure from the stance the province has taken through much of the pandemic. In the letter, Dr. Kieran Moore calls out Niagara's Medical Officer of Health, Dr. Mustafa Hirji, for not consulting with the province and other local health leaders before making his plans. Moore wrote that dismissing cohorts with positive cases could have negative impacts on the well-being of children and their families.
What I'm trying to have across Ontario is a consistent and persistent approach so that parents, school boards, families can expect the same level of protection and care. And so I did have a conversation with Niagara to understand a different approach. That medical officer of health informed me of why they're making them, and that dialogue continues. And I have the similar dialogue with health units across this province.
Moore also says some measures like carbon dioxide monitoring in classes don't have direct ties to COVID safety. In the past, the Premier and Chief Medical Officer of Health said that local areas are free to set their own health rules. Ontario NDP leader Andrea Horwath called Moore's admonishment of Hirji's school measures inappropriate.
I think it's shameful. I'm going to be straight up. I think it's shameful, and I think that it is laudable that local public health units and leadership have been the ones that have stepped into the breach as this Ford government has abdicated its responsibility.
Meanwhile, Hirji says his health unit plans to go ahead with its local measures to allow for added protection for students and staff.